I'm here with Dr. Greg Postal, who's the interim president of the University of Louisville, for what we hope will be a series of conversations about what's going on at the University of Louisville, and we'll have these from time to time, and nothing's off the table. Dr. Postal has promised to try and be more transparent and do a better job of communicating with faculty, staff, students, and friends of the university, so that's what this is all about. This is one way to do that. So, good to see you, Dr. Postal.
Good morning, Mark.
All right, I think one of the things that is the biggest issue, at least on our campus among folks, is the budget. So where are we on dealing with the budget shortfall and making things work in the 17-18 fiscal year?
We've made a lot of progress with our budget. We started working on it, as you know, in January. So we had a very short period of time, actually, to put a budget together that would address all the many issues that we know are taking place around campus, and to try to get a budget that is sustainable for the university. So between January and June, we worked on developing a budget which is actually balanced, and as you know, that was passed by the Board of Trustees on June 15th. And we had some challenges this year because we're thrilled to say we kept our promise to the students and we kept tuition flat. So while other universities in the state increased their tuition as a way of helping to bolster revenue and keep their budget balanced, we did not have that as an option because we wanted to honor our commitment to the students of the university. So we kept that promise. We had a decline in funding from the University of Louisville Foundation. Of course, that's been written about, and I think people are aware that at least we feel it's temporary, but at least right now it feels very real that we've had a decrease in donations and support from the foundations. So that was baked into this budget. And then also just looking at making sure that we are accountable to one another for our spending, whether it's on purchases or how many people we hire, trying to get those things in line so that the ins and the outs balance. We did that, and we have a budget in place now that is balanced. The revenues and the expenses match. That said, the work of a budget isn't just in preparing it. Then you have to live the budget. So now it's July, and this is the first month of our new 17-18 annual budget, and it's difficult, and everybody is working hard, and there's a lot of collaborative effort, but I understand there's pain in some places as people have been asked to make pretty rapid adjustments to make this budget work, and we've done our very, very best to minimize loss of people. So we said from the beginning that we were not going to have widespread rifts of personnel. There have been some individual circumstances where that was necessary, but not across the board. We've tried to minimize that, and so in order to balance a budget and not have a lot of that activity, it requires a great deal of creativity to find other ways to save the money.
Well, are you comfortable with the actions being taken by all the different departments on the university campus and by you and others that in the 17-18 fiscal year, the one we're in right now, that there won't have to be any more dramatic measures between now and the end of June 2018?
I am. As a matter of fact, I'm optimistic to the point I think we'll, throughout the year, be able to announce some good news as we make milestones in the budget, and I think even in some cases exceed milestones in the budget, and maybe lighten up a little bit on some of the cost-saving measures that we've had to put in place. One nice byproduct of this whole process is that people are talking a whole lot more about the budget and working together, so that the deans, the lead financial officers, people in the central financial administration are meeting very, very regularly to talk about this, to see how we're doing, monitoring our progress very frequently. And it's amazing when there's that kind of community involvement, how things really start to work. And so we're starting to see some nice trends developing about costs starting to drift down, and people are watching what they're doing very carefully because they realize we all have to work together to make this possible.
So everybody realizes they've had to cut. Now there's a reason for perhaps some optimism as we go forward that the freezes on, for instance, employees and hiring employees, that may potentially be lifted sometime in the next few months if we're lucky?
Well, I don't think lucky is the word. I think if we're purposeful about putting a plan in place to prevent ourselves from ever being in this situation again. And one thing that I really want people to understand about me is I believe firmly you cannot succeed by cutting. We've all seen examples of companies that have had to make cuts year after year in order to keep meeting budget, and they gradually decline, and they eventually lose their ability to deliver the products that they're known for. And in our case, our products are educated students and healthy patients and funded grants, and those are the products of our business. And so we cannot afford to do anything to harm those products. And so the focus I think you're going to see now is going to start quickly shifting to revenue generation and things that we can do as a university to be more successful, so that as more revenue comes in, we don't have to focus as much attention on cost cutting. Cutting waste and inefficiency and those kinds of things, that should be done regardless, but we don't want to make cuts beyond that. We would rather have a situation where that's not necessary because we have sufficient revenues so that it all works.
Something else has popped up here in the last couple of weeks, actually, the transition from Kentucky I to the University of Louisville Hospital. How did that go, the transition on July 1, and what are the potential problems and the potential great news coming out of this?
Well, I'm glad you asked about that, because it's not only a good story in terms of how the transition worked, but it's a good model of how things can work when faculty and staff all become engaged in a group and feel a sense of ownership to help make a project successful. So if we go back in time perhaps a year and we look at the situation at the University of Louisville Hospital, the nurses, the physicians, the staff who worked there were all very concerned about the future of the hospital. Staffing levels were not what they needed to be. The finances were challenging. There had been some bad publicity about the hospital. And this is a place that takes care of the most needy patients in the community, the people who are the most injured, the people with the most troublesome types of cancer, people who have financial needs. They all go to University of Louisville Hospital and they are given expert care, and we're proud of that. So when the situation started to become such that we were worried about the viability of the hospital, what we saw is that the physicians and the staff and the nurses were able to start to take ownership and realize that they could take this hospital back and we could manage it ourselves and make it a first-class facility, which it always has been. And the result of that has been a very successful transition and tremendous enthusiasm. If you go over there, you'll see a place that is fired up. I mean, these people are coming to work with a purpose every day. We're hiring nurses. Patient satisfaction scores are starting to go up. We have not had to turn away one patient since the 1st of July because of staffing issues. The answer is always yes. A patient comes to the hospital, we find a bed, and we get them in. And that's not been the case in the last couple of years. So I think that should serve as a model of what can happen if people work as a team.
And so looking forward, there's going to be an umbrella organization, I believe, called UofL Healthcare, correct?
Or UofL Health. We're still looking at those kinds of names. But there's an umbrella organization. Yeah. So is there a look to perhaps expand, or to pull all of the different UofL entities regarded in doing healthcare together? ULP, University Hospital. What else? What else we got out there? Is that the idea to pull all those together and then expand perhaps statewide, or what's the thought here? Sure. Well, this is an idea that's evolving, and we're doing a lot of work on this, and we're considering what other places have done that have had successful projects like this. And what you see nationwide is that academic medical centers tend to do well when there is coordination between the parts that make up the whole healthcare enterprise. So you have a hospital, you have a physician group, in our case ULP, you have our insurance company that provides for our insurance needs. You have the healthcare campus of the university itself, so the School of Medicine, Dentistry, Nursing, Public Health, all those schools that have students and residents and trainees in our various programs. And so to bring all of those together in an organization that allows for better coordination and delivery of care will be of benefit to us. Now, the details about the structure of that and the governance and the finances are still being developed, so there are no announcements to make yet, but this is an active project. We're looking carefully at what other places have done, and there's some nice models out there.
There's a couple issues I want to go through pretty quickly because I think they've been in the news, and I don't know that they deserve a lot of our time because most folks know about it. But accreditation, where is the University of Louisville with the SACS accreditation?
Well, accreditation is an ongoing project. It is a big deal. And what some people don't realize is there are really two different processes related to accreditation. We have ongoing accreditation, and so there are processes that go on involving lots of people all the time to sort of continually prepare ourselves for continued accreditation. Okay, so that's sort of the backdrop and actually a very big body of work. And then superimposed on that, we have the work associated with the probation that we currently find ourselves under and making sure that the concerns raised by SACS are all addressed. So these two things are related, but they're separate processes. And so what we are planning is a trip to the headquarters of the Southern Association of Colleges and Schools next month to make sure we have a good dialogue with them about all of the things they're going to want to look at and study when they come here for the special visit. We then have reports that are due to SACS all by the middle of August, so those are being finalized as we speak. The special site visit team will come here in mid-September for a couple of days. They'll send us a report in October. We have till November to respond to that report, and then we go to their annual meeting in December to learn the results. And so almost every month there's a major event related to the preparatory work
before the end of the year.
For the end of the year, yes.
Are you optimistic that the university can meet what SACS has asked us to do to retain our accreditation?
Well, I'll answer your question by saying that every question they have asked has been fully answered. The problems that they raised in these questions have been fixed. We have very clear evidence to show them that some of the things they were concerned about cannot happen again. And so the issues, it's not as though the issues are being addressed, the issues have been addressed. And so we're in the process of documenting that to them. Now, that said, none of us have ever been through a process like this before. And so I don't have a crystal ball. I can't predict, exactly what the dialogue is going to be. But I do know that we've answered their questions and the problems are fixed. And so I'm not sure what else there is to say.
Real quick, the audit of the foundation, anything new, or that just goes along? I mean, we can answer these again real quickly.
Right. The board will be meeting again on August 10th, the UofL Board of Trustees, to consider additional information that has been learned since the audit was initially released. I think they're going to have a long conversation on that day, and then there'll be more news forthcoming. But as of today, there's really no news to report. And
you got a new deal with the Arena Authority off the table yesterday. That was approved, right?
We did. It was approved by both the University of Louisville Athletic Association Board and also our UofL Board of Trustees, and that's been a hard conversation. Anytime a university has to put in more money to pay for a facility, or God forbid, ask our ticket holders to pay more for the tickets that they purchased to come to see games, that's a painful decision. And unfortunately, it comes at a bad time. You mentioned earlier about the budget. So here we are trying to find ways to balance our budget and save money, and now we have this, where we're looking at an uptick in cost. That said, the arena is there. We have a beautiful $350 million building. We can't relive the decision to build it. It's there. Everybody loves it when they go there. It's a great home for our basketball team. And so we have to pay for it. And so I know the city is being asked to pay more than they'd like. The state has had to make decisions about revenue from taxes that they probably weren't real happy about. We've been placed in an awkward position where we've had to decide to give more money. And so that's why there was so much dialogue around this leading up to it, and then even at the meeting yesterday there was a really active conversation. But at the end of the day, I think we did the right thing. I don't think we had a choice. given all the circumstances, but to step up and agree to help with the problem.
And the NCAA investigation, nothing new on that. Everybody knows what's going on with that.
Our
it's a wait and see.
Our appeal report is due
see.
August 9th,
Okay.
so it's being written as we speak.
Okay, well, let's talk about a couple other issues. You just hired or named some new interim vice presidents and top staff members at the University of Louisville. Who are they?
That's right. So we had a couple of retirements. So Dan Hall retired after a long career here as the vice president for community engagement. And we were fortunate that his right-hand man, Ralph Fitzpatrick, who's also worked here for a long, long time and is widely respected, was agreeable to serve as the interim vice president. So he's now in that role. Keith Inman, who everyone knows, retired after a long career. His career at the University of Louisville started in the 70s. He was a student here. He came and went a couple times over the decades, but he spent 11 years most recently as Vice President for Advancement. He retired. And so Brian Robinson, who is a very experienced fundraiser and development officer and a skilled administrator as well, was eager to step up and make sure that there was no void in that role. And then we were also very sad to learn that Janelle Hughes stepped down to pursue an opportunity actually in another state closer to where the rest of her family lives. So we're happy for her that she has that opportunity, but she's very good, and it's a loss to the university. But again, we were fortunate. John Elliott, who's not as well known on this campus, but certainly on the health sciences campus, John is well known because he manages human resources both at the hospital and at ULP. And he's a real HR professional. He came from Dartmouth. We hired him from there years ago. And in the interim, he has expressed willingness to help us coordinate HR activities in all three places, at the university, at the hospital, and at ULP, which perhaps could give us an opportunity to look at HR across the board, maybe in a little more coordinated way, so there aren't big differences in how we handle benefits and that sort of thing between the organizations, and explore opportunities there.
And as we move forward with the University of Louisville in the next several months, you have talked already a little bit about keeping in line with the 2020 plan that was put together a few years ago. So what are you going to be talking about in the next few months and telling faculty, staff, and students in terms of the long-range plans for the University of Louisville? Are you coming up with a brand new one, or are you going to keep what we had and think it was pretty good? We just need to get with it.
Well, I think the key is that we've reached a point now. It's the beginning of a new school year. Students are going to be all returning to campus here soon to begin the 17-18 academic year. We've focused since January very heavily on resolving problems that we all know about, and some of which we've talked about today. And obviously we have to work those problems to conclusion. So that's going to be going on. But I'm to the point where we know we're working on those problems. We have competent teams of people addressing them. They're going to get completed. But we have to start turning our focus to where we're going next. I don't think it's possible for people to come to work every day and be excited about solving old problems, right? I mean, I think people are pleased that those problems are being addressed, and I hope comforted that they're being addressed in a thoughtful way. But for people to be enthusiastic, they have something to look forward to, and that means, you know, what is our strategy and how are we going to follow it? Now, this campus could conclude collectively that they need a new strategic plan, and I don't know. That might turn out to be the case. But for the present time, we have a strategic plan that we are already supposed to be working from. So the 2020 plan, which was written in 2008, talks about things that are important to the university. If you think about what is contained there, it talks about education, research, diversity, community engagement, and stewardship of resources. Those are the 5 pillars of the 2020 plan. I don't know how anybody could improve
Nobody's
on
against
that,
those.
right? I mean, that's what we're all about, right? So then 4 years later, in 2012, the 21st Century Initiative was created, which was really, it was not a new strategic plan. It was a way to help facilitate the accomplishment of goals as outlined in the 2020 plan. A roadmap, I guess, would be a way to describe it.
And to target resources too, right?
Well, and to target resources. Now, you know, my concern that the deficiency of both the 2020 plan and the 21st Century Initiative was not the quality of the goals. It was that I don't think enough thought was given into how all the resources would be marshaled to accomplish those goals. And so if you look back, what you'll see is that some of the things were done and some of them weren't. And so from my perspective, that makes a good starting point. We should look at those and understand if there's something there we can really work with and get the faculty and the staff excited about getting back on track to do things that we have felt are important for a long time. Now, along the way, if there's a decision that we need to refresh it or rewrite it or do a new plan, the campus community will have to help me decide that. But for the time being, we have something that is very good that we just need to follow.
Okay. And that's what you're going to be talking about in the coming months. As a kind of a close here, what would you say to faculty, staff, and students and friends of the University of Louisville about the status of the university right now and where we're going?
Well, what I would tell them is that this community is hopeful about the future of the University of Louisville. In the job I'm in, I have the unique opportunity to talk to so many people. I talk to potential donors, I talk to politicians, I talk to citizens of the community, students, staff, faculty, administrators, board members. And so I think I have a very good sense for what the community is saying and what the community is thinking. And I hear a tremendous amount of optimism. And I hear that people are pleased that the University of Louisville is getting ready to move to the next stage in its evolution, and that this place is really going to do great things and be a contributing member in this community. I don't hear pessimism or people focused on bad things. I hear people hopeful that we're ready to do some big things, and that's exciting to me because, you know, I put everything I have into this job and I come in here every day, and it would be difficult to do this if I didn't get a sense that there was enthusiasm and support from our community.
All right, Dr. Postal, thanks a lot. We'll do it again.
Thank you, Mark. I'll look forward to it.